Hi, I'm Dr. Scott Jensen, and it gives me great pleasure today to do a video with Christina Jax. She is a specialist in dietetics, nutrition. I'll let her introduce herself, but most importantly, in the world of what we've gone through the last 24 months, a lot of people have asked questions of me and of Christina that what can I do to be my own best champion of my health? And I think that's really an important concept. So we're going to talk today and do a few videos, and then we're going to do a full-blown podcast down the road. But in order to do that, we're going to want questions from you so that you can help direct the conversation into the most relevant topics you think are important. Christina, would you introduce yourself and tell the audience how you fit into that team concept of foundational health?
Yeah, so I'm a registered dietitian, nutrition nerd, as I like to call myself, but nutrition and the inputs that we put in our body are the building blocks of our health. So I am biased, but I do think that nutrition and how we eat is pretty much one of the most vital things for foundational health. Building that base, that infrastructure of our body to be able to live our most optimized self. I'm part of the healthcare team in the fact that I'm an expert in how to nourish yourself and to do it in an individualized way. But honestly, we need a team. Integrative care, which is something we should continue to champion, promotes the best care for the patient. Siloed approach to healthcare, which is kind of what we've been doing, doesn't work, and we see that because we all have pieces of that holistic healthcare puzzle, and we need to tap into that.
You really hit a nerve for me, Christina, because that siloed healthcare is so much of what we do in medicine. I had a patient in the other day, and I noticed that a different physician had put her on a new medicine that was absolutely in conflict with the medicine I had put her on a month ago. And I looked at it, and it was like, this one does this, and this one does, and I said, well, we may as well get rid of both.
Yeah.
This patient had suffered, if you will, the siloing of physicians. One doctor takes care of this piece, another doctor takes care of this piece. So I think you're right. We need to integrate healthcare to optimize it. Tell us a little bit about your pathway to expertise. Where did you get your training, and what did you do in that regard?
Yeah, I love that. So I went to the University of Minnesota, so I'm a gopher, and I think we do such a great job in this state on teaching the principles of health. And so I like to see that continue to go into action in this state as well. But my pathway is I worked in the hospital setting, so I got to see what sick care is all about, and I knew that that is an important element to have dietitians in the hospital when people are in an acute situation to help them, transition out of that. But what I really got into my field to do is to help people live their most optimized life, to actually do health care, not sick care. I want them to not have to go down that road of chronic disease. I want them to live their most optimized life, not a life where you're constantly going, to doctor's appointments because you're not feeling well.
When we do our podcast, would you be willing to elaborate on things like vitamin C and D and zinc and how people might put themselves in a position where they would best recover from viral infections and things like that?
Absolutely, and I think there's so many tiny little things that you can just do that aren't even a heavy lift for a person to do, just to add into their repertoire, into their habits that build that foundational health. Again, you can't build a really strong wall. You can't really build a strong foundation of your house if you don't have the right inputs, if you don't have the right bricks, and that's true of the human experience. I would say the other thing is that we put too many inputs in our body that actually distract. So it's not about just putting in good things like vitamin C and vitamin D and fiber and all those things that we hear about. It's knock it off on the stuff that's detracting from your health, which is the junk food, Dr. Jensen.
Well, these are good cookies. Chocolate chip cookies. And I checked, and they've got sugar in them, so I know I'm getting carbohydrates, and they've got some wheat flour, so I'm getting a grain, and then I got niacin in there, and flour, and then the cream and eggs, so I'm getting dairy. Would this be healthy?
Actually, it is what I call a sometimes food, because food is meant to be joy, but too much of those things can cause a level of inflammation, and we know that chronic inflammation, so doing those types of things on a habitual...
What if I take an Advil with it?
Well, then now you could end up with digestive health issues because too much Advil. See, remember, there's all these unintended consequences of things.
So just eat these and skip the Advil.
Or have them sometimes.
Okay.
And make sure you have some fruits and vegetables.
These are the kinds of things we're going to talk about in the podcast. We might even get Christina to look at the package and sort of help us understand it better. It says 140, and I guess I didn't know if that was my IQ, but no, it's calories. It's calories. Sorry about that. Christina, thanks for being with us.
Yeah.
We'll do a couple more videos, and we'll have a podcast that goes in depth.
Sounds great.